If I have a family member or a friend that gets diagnosed with cancer, the first thing I usually tell them is don't go to Dr. Google. Dr. Google is not your friend. It will do nothing but freak you out and get your head spinning, and it's not going to be helpful. The second thing I tell them is that one of the reasons I went into colorectal surgery is because colorectal cancer is one of those cancers we can cure, especially nowadays. There's so many different treatment modalities that we have at our disposal, that now we can really treat colorectal cancer and have you back to living your life, have you back to being a grandma, a dad that likes to kayak and do activities that he or she likes to do. So that's the second thing I tell them. And then the third thing I go over, well, you have colon cancer or you have rectal cancer. These are the treatment modalities that are at our disposal. And now we got to figure out which ones we got to choose, and we got to figure out if we got to choose both of them, one before the other, and how the sequence is going to be. But we will get through it. And I also always tell them cancer is a journey. It is not going to be a journey that's going to end for you, but it's a journey, and it's a journey that we're going to take together. It's a journey that you will eventually be able to see forward and look forward, and you will eventually be able to look backwards and say, you know what, this happened and I beat it, and you will be stronger with it. And that usually makes people think, maybe now we can talk. But it doesn't take away the entire, the entire angst of having cancer. But at least I hope that from talking to some patient, it makes them feel that this is not it. So let me focus now and figure out how we can do this. I usually tell them, just get in your fight mode, because we're gonna fight it, and we usually beat it.